Well, hello everyone. It's great to have you join us on this Men's Health Week panel. My name is David Pointon. I'm the co-founder and CEO of the Men's Table, and it's great to be joined here by four esteemed panellists who I'll introduce very shortly. The topic for today is a preventative approach to men's well-being, and the theme for the overall Men's Health Week thematic for the country is go and see your GP. So we're sort of blending those two together, the preventative approach and seeing your GP. So just on that then, it's my pleasure to introduce our panellists. I'll introduce all four of them and then just have them say a couple of words to find their way into the conversation. Firstly, Dr. Glenn Duns, who's a holistic and lifestyle medicine practitioner in Melbourne. 25 years experience with a focus on men's health and sexual health. So hello, Glenn.
Good morning. Thanks for having me here.
Pleasure. Next, we have Hilary Sansoni, who is a member of the Men's Table community, member of the Sunshine Men's Table, and also has been a very active volunteer in our program, helping other men engage with the program. Say hello, Hilary.
Afternoon, everyone. Lovely to be with you all. Thank you.
Thanks, Hilary. Next, we have Keith Cowen, a farmer and member of the Griffith's Men's Table in regional New South Wales. Hello, Keith.
Hello, David. Thank you for the invitation to take part in this. It's really good.
Great to have you here. And last but not least is Ben Moffatt, the table program lead at the Men's Table, but also with a background in psychology and counselling and started his career in construction. Hello, Ben.
Yeah, good morning. Thank you, David, and great to be on the panel. Thank you.
Fantastic. Gentlemen, we'll keep this conversational. I'd like to just kick off by asking any of you to share in no particular order just why join this panel? What was interesting to you about having a say and contributing to content that will go out into the world and hopefully educate other men about preventative health and seeing a GP? Who'd like to go first?
Happy to do that, David. Thank you. Yeah, look, for me, it was a great opportunity to give back. The Men's Table is an organization that's really become very close and dear to my heart. And by being on here, hopefully I can maybe just inspire men to take better self-care. Yeah, that's it in a nutshell. Thanks.
Great.
Yeah, David, I suppose my experience is coming from a position of having a massive heart attack in a remote area and now very passionate about educating men to take better care of themselves and maybe be a bit more proactive in taking care of not just their physical health, but also their mental health. So I like to advocate very strongly in the community for those issues. And I think when it comes from someone who's got a lived experience, it resonates really strongly with men in the community.
Absolutely. Thank you.
Yeah, I think for me, I just liked the sound of it to start with. It sounded like a great conversation, and I didn't want to miss out, actually. But I guess I'm also conscious that, in my role as a counsellor, for the last little while, just listening to men and what they've had to say, prevention, I think, is something that has been so important. And the earlier that the men that I spoke to noticed something and then took action, the better things turned out for them. And yet I know there are a lot of pressures that might delay taking action. So I think this conversation and the messages that are going to come out of that are really exciting for me, because I think if men are hearing that and seeing, the great examples of Hilary and Keith as they speak about their, as you said, lived experience, it has a lot of power, and I'm excited by that.
Thank you, Ben.
Yeah, so look, this is definitely something I'm very interested in. So I work as a men's health practitioner at Men's Health Melbourne in central Melbourne, CBD. I work as a general practitioner a couple of days a week. And I've also have a master's in public health, where, I had a particular interest in preventative medicine. So we know that men are less prone to engaging in healthcare and seeing general practitioners. And I certainly, we know that from research, and we see that as well in clinical practice. Sometimes men not delaying engagement with the general practitioner or with the healthcare system, and there are obviously potentially serious consequences with that. So, anything that can help to encourage men to engage with healthcare, engage with preventative medicine, see their GP. I'm very enthusiastic to be a part of that. And this is really, I haven't had much contact with the men's health table. I became engaged, or I was invited to this by someone that I know through the local cricket club. But the work, I think the work that the men's health table is doing is fantastic, and I'm really pleased to be a part of it.
Thanks, Glenn. Fantastic. We'll dig in just a minute into the some of those reasons why men might be slow or reluctant to come toward their GP. What I'd like to do is ask any of you to share a bit more about your own health experience, your experience with getting to the GP. You've already given us a bit of a clue, Keith, of your heart attack. Maybe tell us a bit more of your story. Hilary, we know you've had also some massive challenges. I'll kick off to sort of intertwine the idea of sharing a bit of your own health story, but also what gets in the way of men getting to a GP. And Glenn, you might share some of your understandings, having dug into the data of what does create blocks or barriers for men to get to their GP. Just very briefly, for me to kick us off, I've been fortunate. I've been in good health most of my life. I've got a couple of adult children, and my daughter in her late 20s is starting to encourage me. Hey, Dad, have you seen a GP recently? And this only a couple of years ago, and I've shared this story before, only a couple of years ago, this became a little bit of a regular nudge from her, because I wasn't taking up her encouragement. So it was probably over a course of about 2 years that, she started to get a little bit more strident. Dad, have you done anything about our last conversation? And finally, I sort of relinquished and said, okay, I will. In fact, I did her a deal, because she was also driving around with a flat tire in the back in the boot of her car. And I said, we do a deal. You get that flat tire sorted, and I'll go and see a GP. So it took encouragement. And why was I blocked? Because I probably carry around a pretty classic sort of notion that I'll be fine. Things will be fine. I don't really need it. It's just an inconvenience. It's just something else I have to do, rather than taking that preventative and proactive approach. It was actually also my men's table where one of the men was just talking about, having gone through some recent tests, and it got me thinking more, and it kind of normalised it, right? Just another man across the other side of the table. And it was kind of like, okay, it's time for me to just do this. So I've now found a GP that I'm comfortable with. That was probably the other thing. I didn't have a relationship with a GP that I felt trusting with, and where we'd sort of signed up, like, will you be my GP for the long term kind of thing. And I found one, and now I feel more confident, and like we are a partnership, he and I working together on my health. So that's a little of my story. So please feel free to share your own experience and health journey, and intertwine that with, what gets in the way for you, or your observations of what gets in the way of men going to see their GP and getting help. Maybe Keith, do you want to kick us off?
Okay. Yeah, well, I guess I have a really good relationship with the GP I've got. I've been with him for 30 odd years. I guess the biggest problem when you live in a remote area is access to a lot of the tests that you need to have if you wanted to have CT angiograms. Not having a cardiologist full-time in the town are all blocks that make it difficult for regional men to seek treatment locally. And unfortunately, fortunately, I turned 60, and then within a couple of weeks later, had a massive heart attack. I was a very fit man running the farm on my own, and I was probably the last bloke in the district most people thought would ever have a massive heart attack. But it was an eye-opener to me that living on the property for 50 years, I never really thought of myself as being in a remote area until I come across this massive health crisis of 100% blockage in an artery, which led me to eventually end up on a heart transplant list, and then 2 years ago receiving a transplanted heart. So it's been quite a journey, and people are fascinated with that story, and it's a really uplifting story because I'm still here today, and I find it resonates so well with other men in the community. If I stand up and talk at a Rotary or a Probus or a Lions Club meeting and talk about my journey, it coming as a lived thing that you've actually gone through, I find it resonates really well with other men in the room. They go out, they tell their sons, they tell their nephews, their mates. I just listened to a bloke who had a heart attack and then had a heart transplant, and you don't want to go through that, what he's been through. And they go off and they do, and they get the test done. It seems to be, hearing it from someone who's gone through it resonates so well that they actually, more so than all the information that's on television, and we all see the stats of 118 men dying every day in Australia from heart attack or heart disease, doesn't resonate the same as someone standing up in front of you and telling their story. And so I'm very passionate about telling everyone what I've been through, just to try and save more lives, get men to take control of their physical and mental health, because it's basically all tied together.
Fantastic. Great what you're doing out there. Anyone got any questions of Keith? Want to dig in any further with his story? Well, no doubt we'll loop back through your story again, Keith. Who's next?
Happy to go, David, and share. Yeah, my experience was pretty much a dark journey. Initially, following the passing of my daughter, and then her mother passed shortly after, and the aftermath of that pretty much was that I had a diagnosis of permanent depression, which I very reluctantly have come to accept. I certainly railed about it in the early days. And I thought, look, I've got to change my perspective and look at it as a positive, and work with the GP, who was extremely supportive. And, unbeknownst to me, I didn't fully appreciate the outcome or the effects of stress. And I ended up with a cardiac arrest. And following that, spent a month in Royal Melbourne having a triple bypass because my arteries are clogged, and I couldn't work that one out because I thought, hey, I've done everything possible. I'm fit, I have a regular exercise program, etc. Not having awareness how stress can elevate one's cortisol levels, and that was what happened to me. As a result, I look at things completely differently, and a passionate advocate like you, Keith, for men of all ages, particularly my sons who are now young fathers, and say, listen, go get the checks done regularly. That's what I do. On a regular basis, keep tabs, and I look at it as a positive thing. I've changed my GP recently and got onto a much younger guy who's very passionate, very thorough, and I feel I'm in really, really good hands, and that gives me and my family a lot of peace of mind. So like you, David, with your daughter, with my sons, it's a two-way thing. They don't have to worry about me. They know that I'm very mindful of my health because I have that solid relationship with my GP. Yeah, so that's me for now. Thanks.
Thank you.
Mm. Yeah, I'd like to pick up on something that Hilary touched on there, and Keith, you spoke about it too, and it's that and I've got so much to share, I guess, in terms of all the stories I've heard from men, but I might start with just a personal account first of my own health, and I guess I've been very fortunate with the work that I've had to be listening to so many men, and they've shared so many insights about their own experiences, and it's even happening in this conversation right now where I'm learning new things about what to be sensitive to, and yet I think if I look back at I guess my own journey toward a GP and the value that it plays in my life now, and the obstacles if I go back in time that existed there, I think there was some family stuff in there about that kind of traditional masculinity of the sort of this, particularly I think my grandfather was spoken about with a lot of reverence about not needing as much as a headache tablet and things like that, and I guess that just listening to that as a boy, it kind of played on my mind as that's maybe something I would aspire to. The people would describe me in the same way as kind of self-contained and not needing things, and I don't realize perhaps how much that I carried that, and then it wasn't until I'd probably left it quite late actually in terms of my own sort of needs for health, where it was what I went to the GP for was my sleep. My sleep was was just out of balance, and I knew from my own studies that sleep's really important, and I also knew that I felt like I was going okay, but it wasn't until I sat with the GP and I said to them, look, I need support with my sleep. I need to get that on track. And he was an excellent GP and still is. I still see them and just asked some really great questions that were actually broader than sleep and really got me thinking about things that I hadn't been thinking about. And even though I'd probably left it a little late, and even though I'd gone in for what I thought was a talk about sleep, I came out much more informed and much more prepared, I think, and much more in partnership with my own body. Because I think up until that point, I was just annoyed that I couldn't sleep, and I just wanted my body to do what I wanted it to do. But I needed to rebuild that relationship, I think, with my body first, and the GP helped me with that, which I think is really profound, actually, for me.
Fantastic, thanks, Ben. Glenn.
Yeah, look, there's a couple of points I think that have been raised by everyone. So one of the things is that I think it's that the concept of traditional masculinity, and which Ben is talking about, and being stoic and not having to go to see the doctor, and I think that can be reframed. I think that a few people have mentioned being someone who takes action, who's proactive about their health, and so kind of reframing about being someone who is proactive and who does go and a man of action, so to speak, someone who takes control of their health. And I think, Ben has mentioned that that can actually provide reassurance to the people around you as well. So you're not just looking after your own health, you're looking after the health of the people around you, both psychological, social, physical. So I think, there's a lot of really positive messages, and I think there's a role in trying to reframe, what it is to be masculine, and I think that's part of the work that the Men's Table is doing. In terms of attending the GP, I think it doesn't matter where you are in terms of your health status. So if you're in perfectly good health, the general practitioner, the doctors can help you to maintain that good health by doing primary prevention. So, ensuring that you have a healthy lifestyle, ensuring that you're having the appropriate vaccinations depending on what your age is, what your health status. if you're someone who already has a pre-existing medical condition, your general practitioner can help you to try to prevent complications from that medical condition. So that's what we call tertiary prevention. So no matter where you are in terms of your health journey or your health status, attending your general practitioner can help maintain your health or help prevent complications or pick things up early before you develop complications from them. So there's always a reason to be attending your general practitioner. And I think that one of the things that we can try to do is encourage young people, and I think that's, one of the roles of the men's table is to try to encourage younger members to attend their GP so that they can do that preventative medicine and prevent them from developing chronic medical conditions. So I don't know if that's something that's worth kind of talking about and exploring, is experiences that people have had with the men's table of, mentoring younger men, whether that would be worth exploring.
Absolutely. So picking up on that theme and also just the general idea of prevention and preventative health. Keith, you talked about, being an advocate now and really encouraging and trying to inspire others. You started off with that as well, Hilary. Maybe let's dig into, what does preventative health look like? What kind of actions does it involve? What's the mindset? Let's help the audience to understand more what we mean and help them think through, what does preventative health look like for them? So maybe building on from your own experiences, what's your ideas and encouragement to others about preventative health?
Yeah, from my point of view, David, I think when I started on this journey, I was a non-smoker. I wasn't really a drinker, rarely had a drink. I was very fit, so I thought I was pretty much bulletproof as far as a heart attack was concerned. When I looked at my history, I found out, my grandfather died at 80 from a heart attack. My dad had a heart attack at 70. I had a heart attack at 60. I was the healthiest of all three of them. But the genetic component is an area that if you've got those issues within your family, you need to be much more proactive at seeking out and talking to your GP about these unfortunate genetic genes that you might pick up and make you predisposed to having a heart attack much earlier. When I spoke to the cardiologist in Sydney, they said what happened to me is what they see all the time, that every decade there is a drop of about 10 years in when people experience these issues. So I thought it was pretty rare and special, and I got down there and said, no, we see it all the time. It just through generations, it drops each time. So I think if you've got those issues, as well as you may have lifestyle issues of smoking or drinking too much or being overweight, it's just necessary to go every 12 months at least and thrash it out with your GP and work out what you need to do for your age group, where you need to start being more proactive and seeking out the tests, to being referred to cardiologists and getting it on their books early so you build a relationship with your cardiologist also. So I think it's all about taking control.
Just on that one, Keith, just another question to you. You were a runner, you were fit. The people in the district maybe thought you were the last one who's going to have a heart attack. Now that you've been down the path and no doubt have dealt with cardiologists and so on, do you know anything, and what specific advice do you give men about the kind of tests they should be asking their doctor about, etc.? Because maybe other men are thinking, well, I probably don't need any tests because I'm a runner and I'm fit too.
Yeah, well, it's you've still got to look at your genetics, and genetics can get you in the end. And if they've got a history in the family, don't hold back. Get referred to a cardiologist. Get him to do a stress test or have a CT angiogram, or there's lots of tests out there that cardiologists can use these days for early detection, and we need to be utilising this technology. We don't have to wait like we've done in the past for issues to go wrong. My issue could have been sorted 6 months earlier if I'd been able to get a CT angiogram and had a couple of stents in. One stent in would have fixed me from having this massive heart attack. So I was very proactive about my life. I just didn't have the access to a lot of the tests that I need locally. That was a big problem.
Yeah. Yeah. Thank you. Hilary, I was curious about your experience too. You had the experience, the life experiences, the sad loss of your daughter and your daughter's mother, and then that brought about stress, and then that led to the heart attacks, is what I heard. Somebody who's experiencing loss, or maybe is experiencing something else that's sort of bringing down their mental health. I mean, what's the preventative steps there? And were you already seeing somebody about that before you had the heart attack? Tell us a bit more about your experience about prevention.
Absolutely, David. I just like to shout out to Keith, because the point he raised, I think, is critical. It's simply not possible to outrun one's genetics. When I was doing my rehab in the Austin, there were a list of 10 factors, and I ticked off 7 that I was complying with. The ones that I couldn't do anything about were age, gender, and genes. And that was, pretty much, it. I love the way that, Glenn's spoken, and he's involved holistically, which is fabulous. So to come back to the question you asked, David, and I'd like to clarify for the audience, because this is something that comes up time and time again, and I've got quite used to it. A cardiac arrest and a heart attack aren't necessarily the same. One is a circulation problem. That's a heart attack. So one can still be conscious and have awareness that something's amiss. With a cardiac arrest, it's electrical. System just shuts down. Lights out, gone. Technically dead. And I was for 9 minutes. There was no warning. Like Keith, I'm a non-smoker, non-drinker. I'd been running that morning. I thought I was pretty fit. Fortunately, I was amongst people when I keeled over, and I apparently that's exactly what happened, keeled over. Ambulance got there pretty quickly and took me to the Royal Melbourne, and got me back in shape fairly quickly. So I was incredibly lucky with the response and the resuscitation, to be able to come back with cognitive abilities intact. So that was a huge thing for me. Since then, I look at something that Ben touched on, sleep, which is enormously important, along with nutrition and exercise. I don't have to worry about self-medication because that's not an issue for me. And as I said, I regularly get all the tests done. But I like to point out once again that the challenge is to find an empathetic GP, someone who resonates, not someone you go to get a script and take off, or you just want some time off work. No, someone who can anticipate stuff. And for me, I have to build that rapport. It has to be more than an interaction or connection. I have to have a bond. It's built on trust. Hey, you tell me what you think and what you recommend and suggest, and I'll do everything in my power to go along with that, so we work together as a team. And I think that's the imperative thing. It has to be something done together. Otherwise, that the success is compromised, I feel. So that's pretty much what I've encountered, and still do. My physical health's good. I'll be turning 72 shortly. I think my mental health's great, and thankfully my emotional state, notwithstanding my diagnosis depression, thanks to the men's table, I managed to keep that going pretty well. It's an ongoing challenge. I make no bones about that. Every day I have to find a reason to live, to put it bluntly, because I know how easy it is to not. So the difficult thing is to move forward, and that's where the men's table's been massive, absolutely life changing for me. Thanks.
Thank you. Yeah, we might loop back to that, Hilary, around the value of peer support in a little while. And thanks for your honesty there. Yeah, Glenn, preventative health from a GP. You've talked about encouraging younger men to get to a doctor and establish a baseline, to have regular check-ins with your patients, encouraging them to come and see their GP. What does it look like at a more practical level? We've heard a few comments there about lifestyle habits and so on. What sort of things are you encouraging your patients with?
It's taking a look at the big picture, and I think Keith and Hilary have raised, some important considerations. So one of them, of course, is family history. So if you have, if there's a strong family history of a particular condition, that's going to influence, for example, when you're going to start doing the screening test, looking for things like prostate cancer, colon cancer. So there's kind of the standard screening programs, but those can be modified based on what your family history is. So it's really looking at the individual. It's looking at lifestyle factors. So really, regular exercise, the importance of regular exercise, the importance of controlling your weight, resistance training, sleep. I think sleep is absolutely huge. I think there's many of you have raised that and highlighted that as a concern. And I'm often seeing people in the men's health practice, men coming in with concerns, for example, about testosterone. They're saying they're feeling fatigued and they have no energy and their libido's dropped. And a lot of the time, it turns out that they have an underlying sleep disorder. 30 to 40% of the kind of adult population has undiagnosed sleep apnea or has sleep apnea. So, I think you need to approach things with first of all, looking at the individual circumstances, and also looking at the big picture and kind of considering what the underlying problem is, and really trying to dig and find out what the underlying problem is. I think engaging young men can be tricky. I think we've all been there in our 20s when you think you're basically bulletproof and immortal. So trying to get through to some of these younger men, there's, I think, different ways to try to overcome the barriers and try to engage with them, and that's something that we definitely look at.
Yeah. Have you got any ideas on engaging younger men to take that first step?
It is something that we're looking at actively. So there's, we're doing some research with the University of Melbourne. Talking to young men about why they decide, for example, to come to a men's health clinic. And it is possible that maybe having more male-friendly atmosphere can actually help to overcome some of those barriers. I think Keith's story is very illustrative of kind of systemic issues in the healthcare system, which I don't think we're going to get into too much, but in the politics of it. But access to healthcare in rural settings is a huge problem, and the health outcomes for men who live in rural regions are certainly poorer than men who live in urban settings. So accessibility factors is really important as well. Maybe telehealth might help to address some of that. And following COVID, certainly there was we basically had about 10 years of telehealth evolution packed into about 1 year. So there's been huge advances with that. I wonder, Keith, if you've been able to access telehealth or if that's been an aspect of your healthcare.
It's been amazing since transplant, because of travelling back and forward to Sydney is a huge cost and prohibitive to a lot of people. I mean, flights, unfortunately, from Griffith to Sydney can be, $400 to $600 one way. And being able to access telehealth has been great. I can go down to 2 visits a year to St Vincent's, and in between we do telehealth. It's just been absolutely amazing. It's certainly for regional areas, we're never going to have the expertise, the specialist doctors. We have to really do more with telehealth and make it more available, and try and keep the cost down, because it just can be so expensive if you live in a regional area. Apart from the specialist costs, the cost of actually getting to those appointments is prohibitive for so many.
Yeah. Ben, what's on your mind about preventative health? Maybe if you've got anything to add into younger men too, because you spend a lot of time working with younger men as well.
Yeah, thanks, David. I've got a few thoughts, and I wanted to go back to something Keith said and maybe find my way back to that question about young people too. Keith said something really profound earlier on about, if he'd known about that and gone 6 months earlier, the outcome might have been quite different. And I know, from your accounts, Keith, that's made a profound difference to other people, that you've told that to, and they've had that chance, to seek help and actually find out something really important that's helped. But as you were talking, it reminded me of a fathers group I used to manage, and one of the men at the group there was talking about, chest pain, and he sort of volunteered it with the space, and all of the men around that group were like, concerned and encouraging him to see the doctor. And he said to the group, look, but what if it's something serious? And it was almost comical, for the group to hear that, because there was this, I guess, collision of something really important, but also something really relatable, I think, for the whole group, because even though they were encouraging him as men to go to seek help, they also really understood that they would probably also feel the same way, that reluctance, to find out. And then I guess I've been reflecting a lot on conversations with the men I've been supporting in counselling, and what I've come to realise is that anxiety has a habit of perhaps just showing up a little bit more in later life. And it's quite surprising, because you might expect that as you get older, you become a master of things more and more. You might expect that you become more in command of what you're doing. And I think for the men I've been supporting, they're really surprised. Why am I more worried now? Things should be getting easier, shouldn't they? And I think that anxiety played its part for that man in saying, what if it's something serious? Because it's an uncertainty. Whilever he's on this side, he's got this heart pain that comes and goes. But taking action, being proactive, and finding out more means learning something. And why this conversation, I guess, is so important to me is that it's making it really clear that in taking action, you're giving yourself that 6 months or more, to know, to use science, to understand what's happening, to ask the good questions about family history and be aware of, putting things into context and really shifting things. And I guess to bring all that back to young people, the thing that I was most conscious of in my previous role, and we did a lot of work around focus groups and surveys and things to try and really understand, what is it about, particularly counselling, that would make it more approachable, that would make it more accessible for our young people. And the two things that came up, one was that they associated health with being old. So they saw, seeking help was about when you're older and things out of your control start to break down, and therefore you have to go. And so there was a real kind of, I guess, pragmatic solutions-focused kind of approach to healthcare. And the other side was uncertainty. What happens when I go there? And so the things that really helped us back then were really driving home the key message of prevention, and whether it applies to physical health or mental health, same rules apply. The earlier that you start something, the better. And the other thing was really just mapping out through stories, social stories, what the experience of counselling would be like. Just telling through case studies, this is what the young person was noticing about themselves. This is what led them to counselling. This is what session 1 looked like. This is what the treatment looked like. And this is what the outcome looked like. And so there's a really nice flow of, events. And that really increased young people's willingness to engage with us, because I guess it demystified the process, and it also challenged that maybe more traditional view of waiting until something's broken before you seek help, and actually encouraging a more proactive approach to that. And I think maybe a final point to say to that is we did tie counselling to a performance enhancement model, where, it might be we went and spoke to elite sports teams and talked about the relationship between your mind and sport, and how there's a complementary balance there between, training your body and training your mind. And that really helped us as well, I think, in many respects. And I can see how that could help in seeking physical health support as well, because it's the same spirit of prevention. It's the same spirit of, just enhancing your performance to be functioning the way you would like.
Yeah, thank you. There's a couple of themes coming up here. One is obviously taking more action, going to see the GP, early action and so on. But the other I'm hearing coming through in different ways is mindset and reframing, and how much just a change in narrative in the way we see things can open up a new door. The opportunity to step into a preventative approach is largely a mindset shift as well, isn't it? Just building on that idea of mindset and what you said before, Hilary, about the value of a peer group. Let's dig in to a peer group, because for some people who might be starting to experience some mental health challenges, there may not yet be a link made to the value of being part of a peer group. And that's what the men's table does. So I'd just like us to dwell into that a little bit as another form of preventative health. What are your experiences about being part of a men's group, a peer group, and the value of that in preventative health? And I suppose from your perspective, Glenn, around this one, what do you see from the research or the work you've done about the value of having social connection to someone's health and mental health as well? So, turning toward peer groups and that as a component of preventative health. Who'd like to pick up?
Yeah, well, I suppose I can start. My introduction to the men's table was basically recovering from transplanting Sydney when I was there for 4 months, twiddling my thumbs and trying to stay alive. And you guys popped up on the Facebook feed, and it really resonated with me when I looked into what you were doing. And I thought, I've got to bring this to Griffith. We need this in regional areas just as much as you need it in the city areas. And the sharing and the trust that's built at the men's table, I think it's a great forum for sharing private information about physical and mental health. And it really encourages men to be much more open. And, as said, I'm very proactive. I'll tell anyone who wants to listen to my story. And if that ripple effect can go on and flow onto other men, I'm very, very happy about that. And it has in the past, just sharing the information to wives or to whoever you talk to in the community, the ripple effect is amazing. So, yeah, I think I've got to turn the negative of what happened to me into a positive of getting the information out there and making more men be brave and take control of their health.
Great.
Sorry, you want me to jump in here? I think so. Look, I think peer support groups, they can be both primary, secondary, and tertiary prevention. So, they can. I think peer support groups can help stop the development of illness, whether it's physical or psychological. Having that peer support, it's really well recognized that social networks become increasingly important as time goes by. So as you're getting older, you need those social networks to maintain your health. I think for someone who is suffering from a medical condition, a chronic medical condition, peer support is an example of tertiary prevention, and it can help to prevent complications from developing. So yeah, I think peer support is a very good example of preventative medicine. In terms of the evidence around, peer support groups, I'm going to handball that to Ben as a counselor because I think Ben could probably actually comment on that better than I can. So,
Thanks, Ben.
Yeah, thank you. Yeah, I've been thinking a lot about the men's table and its value, and I guess summing up all of the experiences and also the research too that backs this up particularly around transitions that men experience and the role that those transitions play, I think, in disconnecting actually from social contacts. And I guess I'm thinking about something we've already touched on, which is injury. And injury may play its part in just a decrease in participation in sport or even an ending to sport. It might also be that in your 40s and 50s, we know statistically that relationships might come to an end. And not only then would you lose, your partner and dealing with that significant change, but it may also be that with all that we talked about earlier on, you might also be losing your health advocate. That dynamic that David was speaking about with, the back and forward between have you been to the GP? I think sometimes our partners play that role for us, and the people in our lives that care for us will maybe encourage us to do things. And in their absence, it's up to us then. And we might not be prepared or just quite ready to think about what our own health needs are. And I think also another transition that happens around our sort of 40s and 50s is children moving out, and perhaps even changes at work. And all of that together, I think, can lead us to be more disconnected. And particularly, I think sport is a really tough one because you're losing an expression of yourself, your physical self, and that feels good. But also, it's a really great reason to get together. And if you're not able to do that anymore, then you need something. And that's where I see the men's table is really unique in its offering. And there is other men's groups out there, but what I really love about what the men's table does is that stoicism we touched on. I think the sharing spaces that are created for our men, it's a real antidote to that stoicism because you're hearing other men talk about their own journeys, their own experiences, and it's happening here in this conversation, and I know it happens at our tables where men are really offering alternatives to that sort of waiting until the last bit. They're dropping clues about what to look for, or even strategies that help them. They're really also normalizing just care for each other, normalizing self-care, and I think all of that, I guess, boils down to a real strong prevention and proactivity, which we've touched on so many times already. And I can just see that when I listen to the men at the tables I'm caring for and just across the team, I can hear that same, care, I think, that men are giving to each other and to themselves at the tables, which I just love. Yeah.
Great, Ben.
Just like to quickly pick up on what Ben spoke about because I've discussed this with him previously about transitions, and ties in really well with peer support. I look at my my boys, the older ones, early 40s, younger ones, late 30s, and if I was to separate myself into two, that would be either then the younger ones doesn't smoke, drink, very fit, in a high pressure environment. The older one also has that high pressure environment, but smokes and drinks. And this is long standing, a lifestyle thing going back to late teens, when the group he was in, a bunch of guys just grew up and went to school, played footy, socialized, very tight group. And now there's a fork in the road, 30 years on, where they're not young anymore. However, denial's, a very strong thing to move forward. And what's happening is conflicting priorities are now starting to emerge. Family, work, which is now taking that bond away. So that support network isn't as strong as it used to be. So I'm finding certain individuals are getting more isolated as a result, and they're going down the self-medicating process. They still think they're 20 rather than in their 40s. Wouldn't dream of going to a GP. Intriguingly, a couple of them have had cardiac issues already. So it just brings it back to transition. And I'm passionate about this because of what you also spoke about, Keith. You spoke about the ripple effect in a positive way. I experienced that in a not so. When I went down, I saw the devastation and trauma it created amongst my nearest and dearest. And I don't want to have anyone go through that inadvertently again. That was really challenging. Yeah, thanks.
Yeah, thank you. We've got time for just a couple of questions from the audience. We've got one here from Stephen. This may not be one that we all have to answer. Do you believe there is an accessibility problem when it comes to men's health? For example, treatment for prostate cancer? If so, why? Anyone want to respond to that question?
Well, that's an easy one for me as far as remoteness, but yeah, it is an issue. I mean, there's a lot of guys need to seek specialist treatment. If it's not available, you've got to go 200, 300, 400 Ks to receive it. It's a big issue.
Yeah.
Yeah, absolutely. I agree. So, seeing an office in the Melbourne CBD, it's quite easy to access, men's healthcare and prostate healthcare. But yeah, obviously there's huge regional disparities, and that's a major issue.
Yeah. Thank you. And then the other question is one from Richard. Can one see a GP too often? What do you say to that, Dr. Duns?
I wouldn't discourage people from attending their general practitioner. So, we're trying to get people to engage. So there's no way I would discourage people from seeing GPs. I think, maybe there's, you can explore the aspect of, is there anxiety, which is driving a frequent presentation? And if there is, then that needs to be addressed. There's considerations about over-investigations, and that can be cause problems as well if someone is being over-investigated. But I think the message we're saying today is be proactive, engage with your GP, engage in preventative medicine.
Yeah. Yeah. Thank you. Anyone else want to say something to that?
Yeah, I'd just like to add that I think anxiety is a really great idea to introduce there, and I think for me the really great something I've noticed and I'm really pleased with is just how well anxiety responds to treatment, to solutions and strategies. Like, it's something that can be quite paralyzing at times, absolutely. But if anxiety is maybe the underlying cause to those presentations to the GP to try and work out what's going on, as soon as that's named, and as soon as strategies are introduced that tackle anxiety, it's just amazing how quickly you can respond. And I think that's a message I really love to share.
Yeah, thank you. Well, that brings us toward a close, and I'd just like to ask each of you to share something, a takeaway message, or even something that's crystallised as a result of you being part of this conversation. As we close out. So something from each of you. And I'll go first because what you've just shared there, Ben, is something that's come clearer to me in this conversation. There's a couple of things that I'm taking out of this. One is just your observation earlier that as we get older, we do tend to experience more stress or anxiety. That's certainly the case for me. Something that I haven't had to deal with for most of my life is starting to come up. And it's actually also affecting and related to my sleep. So for me, one takeout is, going to see the GP specifically about sleep, which was the beginning of your journey. And the other one, I think, touched into your experience, Hilary, that preventative health and seeing a GP and looking after ourselves is not just something that we do selfishly for ourselves. We're actually doing it for our loved ones as well, so that it creates less stress and burden on them. And I think that's a great reframe as to why we might want to, look after ourselves more. So, yeah, there are two takeaways. So thank you for all of you for helping me get clearer on those things. Who's next? Either something that's become clearer or just a key message you want to share with the audience as we wind out.
I think for me, I just feel really proud. All the things we've talked about, and if I reflect on my own life, in a very short amount of time, really, in the space of my lifetime at least, that's the frame of reference I've got, so much has changed. And I just really feel proud of this group of men for just really being so open and sharing, what your experiences are like, and sharing it with the spirit of knowing that it's going to help. And I just think it's really profound. And it's something that as a boy or even a teenager, I would have thought was impossible, for men to be so open and frank about their internal world. And I feel really, really positive about that.
Thank you.
Yeah. I just continuing on from that message. I mean, one of the things that we do at this men's health clinic is we do have a focus on sexual and reproductive health. And I think if you talk about, people being more open and being able to discuss issues, I think that's one really important aspect that we haven't had a chance to touch upon, is that if you do have a sexual health issue, it's very important to speak to someone about it, to see your doctor about it. First of all, I think oftentimes there's men who are suffering in silence. And it's important to seek help, because sometimes the sexual health issue can also be the manifestation of an underlying condition, anxiety, depression, cardiovascular disease, for example, diabetes. So, don't be hesitant to see your doctor about sexual health concerns. I think that's an important message. And I think that, we hope that men are going to feel more comfortable about discussing these concerns. And just to reiterate, I think it's been raised by all of us, be proactive, seek preventative medicine, see your general practitioner.
Thank you.
Yeah, prior to coming on board with the men's table, I had the perception that vulnerability equated with weakness. I've since learned and completely embraced the fact that showing vulnerability is a sign of strength. And without vulnerability, there's no authenticity. And those are the two things that I live by now, because that pretty much frames who I am and what I'm about. And it sustains me. So I'm deeply appreciative to Men's Table for allowing me to step into that space. Yeah, thanks.
Yeah, for me, David, I think it's about sharing. If you share your journey with another man or a group of men, they then open up to you and will share back. And I think we need to share our mental health journeys, our physical health journeys, our stories, and with all age groups. And it just sets men up to be more, to see it as being strong, sharing, rather than being weak. And I think it's really important just to share as much as possible and encourage others to do the same.
Fantastic. Gentlemen, thank you. It's been a great pleasure to have the conversation. I think there's a lot of gold nuggets in here for the people who watch it. And I just want to acknowledge and thank you all. Dr. Duns for being here, Hilary, Sansoni, Keith Cowen and Ben Moffatt. I really appreciate your time, gentlemen, and your sharing of your wisdom and learning. Thank you.
Thank you.
Thank you very much.
Thanks, David.